Good afternoon, everyone, Nigerian time, and thank you for joining us. My name is Dr. Ola Brown, and I'm the managing partner of HealthCap Africa, the continent's leading specialist health tech investor. I'm also a medical physician by training, with a master's in finance, completing my PhD in finance. And I was one of the first women in Nigeria to co-found the venture fund back in 2015, when the ecosystem was still very much in its infancy. The HealthCap Africa team all have similar backgrounds in healthcare, fintech, and investment, giving us really deep subject matter expertise in the areas that we invest. Today marks the launch of our Healthtech Unicorns Insight paper, a data-rich, case-driven report designed not just to analyze the state of African health tech, but to sharpen the conversation about where the next wave of global healthcare innovation will come from. I am super honored to welcome Dr. Amit Verma, founder and managing partner of Quadria Capital, which just closed its $1 billion fund, so one of Asia's largest healthcare funds. And Quadria has backed platforms that scaled healthcare systems across India and Southeast Asia. Inviting him hasn't been a coincidence. We believe through our research and through our experience investing that looking at Asia is actually one of the best ways to invest wisely in Africa. It's actually the closest thing that we have to a crystal ball. And every Nigerian, Kenyan, Ugandan on the call will be able to think of at least one great Indian entrepreneur that has been successful in Kenya or in Uganda, duplicating models that had already been done in India. And I think part of the reason why Indian entrepreneurs are so successful in Africa is because they've seen it all before. They've seen these business models work, and it's very easy to replicate in similar markets with similar demographics. So let's go on to the demographics. Africa is home to 1.5 billion people with a median age of under 20. And it also holds the world's highest burden of unmet clinical need. But that's also its greatest upside, a healthcare transformation. And in today's geopolitical landscape, the stakes have changed. Donor funding from USAID has completely disappeared. And even funding from groups like the WHO and Gavi is being cut, or at least there are rumors of it going to be cut drastically. The entire world is shifting from donation and aid to investment. So now is the time to build scalable, sustainable healthcare infrastructures, platforms that can survive and thrive without donors or grants. And that's where health tech comes in. This isn't just a blank canvas. In the past 3 years, African healthcare startups and health tech startups have raised hundreds of millions of dollars across East, West, North, and South Africa. And we're seeing strong validation, not just from capital inflows, but from exits as well. InstaDeep, an African AI drug discovery company, was acquired by BioNTech for nearly $1 billion. It was one of the largest tech exits in African history, and clear evidence that African deep tech can solve global problems, not just local ones. Rapid Deploy, a South African company, was acquired by Motorola, marking again one of the largest exits in South African history. Its cloud-based emergency response platform is now powering safety infrastructure in developed markets. Again, we're seeing this trend of global relevance. And these aren't just early signals, they're proof points showing that African health tech is ready to scale and exit and compete globally. And as this report shows, while we'll admit that fintech still remains the leading unicorn producer on the continent, health tech isn't that far behind. And in fact, Africa is the most efficient unicorn producing ecosystem in the world when you look at per dollar invested metrics. And that fact tells us about scale, but also about resilience and capital efficiency and outsized potential. A lot of people, particularly in Nigeria, also see health tech, or other oil producing countries such as Saudi Arabia and Qatar, see health tech as a defensive sector. So health tech is one of the few non-discretionary spending categories that grows throughout the cycle, whether commodity prices are high or low. And unlike consumer tech or cryptocurrencies, African health tech is solving problems that don't go away in a downturn. Drug distribution, maternal health, diagnostics. It's impact aligned, but commercial first. And that combination is really rare. So where does HealthCap Africa fit in? HealthCap Africa has invested in companies that now serve over 2 million patients in over 10 countries, working with governments, pharmacies, insurers, and hospitals. We've backed health tech infrastructure from digital distribution to medical credits with teams that blend clinical insight, commercial discipline, and operational speed. We don't just fund innovation, we help shape the healthcare systems of the future. And we've done it with discipline. We have a track record of exits, above benchmark DPI, and a strategy that's not built around hype, but around platform building, patient pipelines, and real-world outcomes. So why this report? Why now? This report doesn't just profile unicorns around the world. It maps the funding data in Africa, the infrastructure and regulatory trends, and the key players, both specialists and generalists, both founders and ecosystem shapers who are contributing to this market. And we think it's something of a blueprint for how to invest well in this space. Dr. Amit's work across Asia proves that emerging markets can build world-class hospitals, diagnostics, insurance platforms, and digital healthcare tools. And that capital, when deployed strategically, can unlock both impacts and returns. HealthCap is a $30 billion fund and one of the largest, if not the largest, focused on health tech in Africa today. Dr. Amit just closed $1 billion. So I think that we are all going to learn a lot from him and the Asian experience in terms of what the future might hold in the next few months to years for Africa. Before I hand over to him, I'd like to share a final thought, which is the most powerful investment opportunities of this century are not just where the need is the greatest, but where the models are already working. And you'll be hearing from our portfolio companies later in this program about their models that are already working, already shaping markets, already scaling across markets in Africa. The second word or piece that I'd like to leave is the fact that Africa's health tech story isn't just beginning, it's accelerating. So this isn't just a report launch, it's an open invitation to build with us, to back the platforms, the people, and the future of healthcare on this continent. Thank you very much. And with that, I'd like to hand over to our special guest of honor and keynote speaker, Dr. Amit, to give his keynote address.
Thank you so much, Ola. Thank you for the kind words. And I do believe that emerging markets in healthcare have a lot of things in common. I break it down to 4 things. I don't know of a single country in Africa or Asia which is spending enough GDP dollars for healthcare. I also believe that there are 3 fundamental issues in healthcare for any country that I look at. Lack of infrastructure, lack of skilled manpower, and lack of who's going to pay for it. And we are hoping today, as I talk to you about our experiences, of extrapolating what we have done in this part of emerging Asia to see whether we can apply it to what you guys are doing in Africa and hopefully create a bridge from which we learn from each other. So I'm going to break it down into a couple of bullet points so that I stay within my time, but more importantly, be able to share with you what we think has been our mantra for some success. So the first fundamental is I'm a critical care physician by training, and I've spent almost a decade in the US, moved back to Asia before it was fashionable for people to come back. I'm still here, so which means things can work. We believe that healthcare is a fundamental right. It is not a privilege. We also believe that Africa stands where Asia was 10 years ago. So this, in many ways, is the convergence moment, where massive healthcare gaps meeting unprecedented digital adoption. And there is now green shoots in the investment momentum. Today's reality, African healthcare startups have attracted only $189 million in 2022, while the digital health market is poised to surpass almost $11 billion by 2025. Now, what are the lessons that we can impart to you from Asia's healthcare investment ecosystem? The first point is that scale matters. At Quadria now, over the past decade, we have deployed almost $3 billion of capital in healthcare. That we believe that sustainable impact requires patient capital and a longer term vision. The second point is what Ola alluded to earlier, is the platform strategy advantage. Successful healthcare scaling demands three pillars: technology integration, stakeholder collaboration, and an adaptive business process. And finally, infrastructure as foundation. Asia's success has come from building robust digital infrastructure first. Africa's 56% rural population lacking essential healthcare access presents both a challenge, but to our minds, a great opportunity. We are very bullish about Africa's looking outside in, Africa's unique unicorn potential. Now, the funding catalyst is beginning to show promise. It's still very small. Gates Foundation, 5 million grants, NEPADS, 12 million supporting 250 young innovators. Very, very small innovations right now, but at least something is happening on the ground. There is also a regulatory evolution that is taking place, especially in our reading countries like Nigeria. Pioneering interoperability guidelines mirror the early Asian know-how that we have gotten used to. And these finally enable scale. There is also a local innovation advantage that we see where African startups are developing context-specific solutions for local challenges. So from telemedicine for rural connectivity to AI-powered diagnostics for resource-constrained settings. Now, to my mind, critical success factors for African healthcare unicorns are divided into 4 bullets. First, address the human resource crisis. With inadequate healthcare workforce being Africa's top challenge, technology must and has to amplify human capacity, not replace it. Number 2, master the funding equation. Move beyond the 10% current healthcare allocation of total startup investments by demonstrating clear ROIs and social impact metrics. And I cannot emphasize more on using financial metrics and social impact metrics in the same breath, because a lot of funding will be dependent on the social impact metrics. The third point is building for interoperability. Cross-border health data sharing capabilities will differentiate winners. So we learn from Asia's fragmented early approach, taking good ideas from country to country and learning of things what not to do. And finally, you cannot do this without government partnership imperative. And with inadequate budget allocations, public-private partnerships are essential. Now, a lot of us sitting in the private sector are trying to circumvent working with the government for all the issues that come along with it. I think after a lot of years, what we finally realized is that you have to find a way of working with the government if you want to scale and you want to reach a certain size. So if I were to suggest to you some strategic recommendations for the path forward, I would again break it up into 4 points. 1, adopt platform thinking. Single point solutions will not create unicorns. Build ecosystems that can expand across multiple healthcare verticals and, more importantly for Africa, geographies. Number 2, focus on measurable impact. demonstrate how technology improves the three critical areas: healthcare work efficiencies, budget optimizations, and leadership effectiveness. Number three, leverage the mobile first advantage. The fact that Africa's smartphone penetration growth creates leapfrog opportunities for health solutions that bypass traditional infrastructure constraints. And lastly, think regional, act local. Success requires understanding that Africa's big four markets, to my mind, Nigeria, Kenya, Egypt, and South Africa, each need tailored approaches while maintaining scalable core platforms. So to close, the opportunity window is now, with $12 million in catalytic funding already deployed, with regulatory frameworks being torn down and people becoming a lot more amiable. I do believe Africa's first healthcare unicorn is a matter of 1 or 2 years and not multiple years. Investment readiness is key. So startups must demonstrate not just innovation, but scalable business models that can attract patient capital required for healthcare transformation. And then there is the multiplier effect. One successful African healthcare unicorn will catalyze an entire ecosystem, just as we witnessed this in Asia's healthcare investment platform. The question isn't whether Africa will produce healthcare unicorns. In my mind, that's given. But which startups will seize this unprecedented convergence of need, technology, and capital to transform healthcare for 1.5 billion people? Thank you so much for your time and attention.
Thank you so much, Dr. Amit. That was absolutely amazing. And I hope everybody can see me. I think some of the things that you said were extremely powerful. Number one, that you believe that the next unicorn is going to emerge in the next few years, not decades. Number two, mobile first. And I think that that's so important, being able to leapfrog using mobile technology. Number three, something that Africans are uncomfortable about, but I'm glad that you addressed the elephant in the room, which is the federal government. Startup founders don't like the government. Private sector people don't like the government. But I think that there's no country in the world that has achieved universal healthcare without the government. So we need to be able to make these critical relationships work. And the last point is about the power of platforms. And that was what I wanted to slightly double down on before I let you go, just to explain to the audience what you mean by platforms versus single point solutions.
So what we've seen is that to make a successful enterprise, we need to bring in different elements onto the same medium to make a big difference. So just to give you an example, if I look at scaling, when I look at healthcare, it requires technology integration. It requires different stakeholders collaborating, and finally adapting business processes to pilot test what works and doesn't work, and be quickly adaptive and give up if things are not showing up on the ground. What we've also realized is that you don't do healthcare in isolation. And just to use a very simple example, if I have a hospital, I am dependent on infrastructure, I am dependent on equipment, I'm dependent on consumables, I'm dependent on drugs, I'm dependent on manpower. So just bringing all those elements together, we would never ever succeed if we were just trying to solve a single problem. But think single point solutions will not be able to create effect across multiple healthcare verticals.
Okay, I can see some excited comments. And could you tell us a bit about your biggest wins in healthcare that you've invested in over the years, and where you feel like the biggest successes have been in terms of portfolio companies?
Yeah, so I should point out that we started off as a growth private equity firm. And we invest in 4 verticals, which is services, hospitals, and diagnostics, life sciences, which is creating scale and not betting on one molecule which will cure cancer. We do medtech, and we do consumer health, anything which is direct to the patient. So this could be point of care testing, dialysis, and it could also be things like hygiene, so adult diapers. So we invest across the spectrum. And about 7 years ago, we built an early stage platform called HealthQuad. This is now a $300 million fund where we started to invest in earlier stage companies which had revenue recognition, but the EBITDA was a far way off. And in that, we have some innovative companies, and we'll be happy to send you some details of that. But just to give you 2 or 3 examples which excite us, there is a company called Cure.ai, Qure.ai, which is probably the world's largest AI radiology platform. Started using it for tuberculosis screening, and now we are using it for lung cancer. We are also investors in another mental health platform called Wysa, WYSA, which is using chatbots to deal with the lack of mental health professionals. And as you know, there's a massive scarcity for it. We also have a platform called Cure Skin, which basically you take photographs of your skin conditions, you upload it on the platform, and you will then get diagnosis back. So as I look across the spectrum of now almost 37 investments between Quadria and HealthQuad, our intention is to be able to back entrepreneurs at their early stage when they still have exciting ideas. They're very excited about what they're doing. They're not just looking for money, but also looking for mentorship. And that's again where we come in and help them scale up. So as we go along, and I hope to be associated as you guys go forward, we'll be sharing more and more, and hopefully we get to see each other physically rather than doing this on Zoom.
Thank you so much. I appreciate your time. I know that you've just closed your fund, so there's a lot of things that you have to do, but it's really exciting to have you here. Practically, I'm looking at the names here, practically the entire health tech ecosystem of Nigeria is here, and the comments have been fantastic. Both on my phone hasn't stopped. My WhatsApp messages haven't stopped coming in, and then on the comments section as well. So please show your appreciation to Dr. Amit. Follow him on and Quadria on LinkedIn. And thank you for your time. Really appreciate it. We're now going to move on to the panel with some portfolio founders.
No, thank you for the opportunity. Pleasure speaking to you.
So we're now going to move on to the panel section, and we've got a great panel that will be speaking to us today. Some of our portfolio companies have come in to talk about what they do and how their path to becoming health tech unicorns, as sort of described in our paper. A lot of them were. We did focus on them and use them as case studies in the paper, but we thought it would be important for me to hear from them directly. So our first panelist is Folake from Emergency Response Africa. Fantastic. And then we have Joseph from LifeBank, and we should have Seth from InstantRad, if he is here. Seth, are you with us?
Yes. Yeah, I'm right.
Fantastic. Here. And it was interesting that Dr. Amit spoke about radiology as one of his standout portfolio companies from, his $1.3 billion. Well, he's put $3 billion into healthcare in Asia, so $3 billion platform. So I think, this would be a good point to start. Can all of our founders introduce themselves and say a little bit about your company?
I guess I can start off. Seth Kwanzaa, I'm the co-founder of InstantRad, and in summary, we are more like the Uber for radiology in Africa. Just to give a little highlight, we just try to provide access to hospitals and patients for, the shortage of radiologists in the region. And as time goes on, I can shed more light into the impact that we are making across Africa. So thank you for the opportunity.
So hi, everyone. Thanks for having me. I'm Folake Owodunni. I'm the co-founder and CEO of Emergency Response Africa. And our focus is really on saving lives by connecting people who are having an emergency to nearby help. Super looking forward to having this conversation and talking about, how our model does that.
Hi, everyone. Good evening. My name is Anikan. I'm Vice President for Growth Partnerships and Innovation at LifeBank. And what LifeBank does is to provide technology solutions that equip hospitals and ensure that they then focus on patients. And by so doing, we have this multidimensional impact on patients, care centers, and the health system. And with the right opportunity, we will discuss how this intricate connection really comes to impact. Thank you very much.
Fantastic. And before we go into more personalized questions for each company, Dr. Amit spoke a lot about being able to articulate your impact. And he said, impact metrics are really important, as well as other forms of traction. So can we start with Seth, talking about some of the impact that you've had, where you've had it, what type of patients, across what spectrum of patients that sort of have been impacted, and what you think is next?
Absolutely. So radiology is fairly young in Africa. When it comes to Nigeria, for instance, there are less than 400 radiologists for the whole country of 210 million people. And so you can imagine if you go for your X-ray or your CT scan, MRI, sometimes it may take 3 days or more, weeks to months for you to get diagnostics. And really medical intervention cannot take place without proper diagnostics. So what we decided to do was to create a borderless or just a spatial arrangement for radiologists to access hospitals in these cases in real time, so that they can report on some of these cases. And we've been able to successfully reduce the turnaround time for some of these interpretation. What used to take 3 days, 3 or 30 days, to less than 4 hours. So now there's a faster delivery of medical intervention and diagnostics. And now we are really increasing, the survival rates of some of these issues. And InstantRad really started on personal, experiences that I had. My grandfather passed away because the interpretation of his, stroke that he had was delayed. And so they didn't know what to do, right? Same thing, I had a cousin who ended up passing away, at age 32 from breast cancer because of misdiagnostics and all of these issues. So we are reducing the number of the turnaround time from what usually takes a long time to a short period of time. And then also another exciting impact that we are having is we are actually bringing in the diasporan specialist. Because there are some Nigerians who wants to give back, who wants to contribute towards healthcare, who are specialized in maybe breast imaging or neuroradiology or MSK, musculoskeletal radiology. So these guys are super, good at what they do. And our platform allows them to get access to these images wherever they are in the UK, US, and report for Nigerian citizens. We've been able to scale up from Nigeria to Ghana and now Cameroon, and we have a line of sight to reach about 10 countries in about 2 years once we are able to provide more language opportunities on the platform.
Fantastic. Folake, do you want to tell us about your impact?
Yeah, for sure. So I think, like Seth said, the company was definitely started from a place of personal experience, having an emergency with my family, and realizing just how exposed we are as Nigerians to the impacts of emergencies, just not having that system. So we started in 2021, and since that time, we've been able to do a number of things. One was grow our responder network. The way that we work is really about identifying and onboarding existing ambulances, hospitals, and first responders onto a network and dispatching them to emergencies. So we've been able to grow that network to over 400 individuals and entities, and this is across 11 different cities in Nigeria, and use that network to address about 7,000 incidents. And this ranges really widely from road accidents, sudden cardiac arrests, complicated labor cases, mental health crises, suicide attempts. We've really, attended to a wide variety of emergencies, and our patient population, about 55% of that is women. And so we're, starting to also gain an understanding of which demographics are at risk for which types of emergencies. Some of the things that we're most proud of are the fact that responder model has helped to reduce response times by as much as 80%. And we have really strong patient feedback. So people, for whom this was life-saving and are giving testimonials, hundreds of testimonials, and a really strong net promoter score. I think, overall as an organization, we've only been focused on Nigeria, but we definitely have our sights set on the continent. And our hope is that, as early as, 2027, we can actually look into moving into other African markets, starting, of course, within West Africa. So, yeah, thank you.
And LifeBank has a beautiful impact story. Do you want to tell us a bit about it?
Absolutely. Thank you very much. I mean, and this stories have been quite inspiring. Thank you to the other founders, Falake and the gentleman at InstantRad. Impact is at the heart of what LifeBank does, which is one of the reasons why when the keynote speaker gave his address, there are certain times where you just need some feedback that what you're doing, has global consequence. For LifeBank, in the way we see impact, you could talk about safety. And when the gentleman was talking about quick turnaround time and results, he spoke to that in a rather sophisticated way, that you innovate around ensuring that consumables are safe, and that when the doctors on site are delivering care, the fact that they don't have to worry that the quality of consumables being used is high is something that we don't talk enough about. We also innovate around materials that they need. And with every intervention, there is a technology that is deployed to make that possible. We also innovate around affordability. Credit is something that care centers can do with, so that they are not concerned that they can pay for certain consumable, whether it's blood or oxygen, etc. And their primary focus is on the patients. And finally, it doesn't matter where you are. If you are in the center of town or in the outskirts of the outskirts, if you need an essential commodity, there is a mechanism by which it can be delivered. So in these 4 areas, we deliver impact. And now when we're talking about impact around demography, over 160,000 women and children, have been impacted by our service. In terms of patient outcome, over 205,000 patients, can say that because of the intervention of LifeBank, they had access to better care. And then when we talk about how out-of-pocket spending affects patients at the bottom of the pyramid, over 105,000 patients that could not pay partly or fully for their service got access to care because of the way we innovate around healthcare. And these are the numbers that really make us proud. But we also recognize, for instance, that there are very many blind spots as you innovate across the continent. So we've learned a lot moving to Kenya. We've learned a lot operating in Ethiopia, and this gives us tremendous muscle memory. It gives us capabilities around innovation, and we are now more aware of blind spots as we even look to expand even deeper in the continent. Thank you.
Fantastic. Brilliant stories. So my next question is specifically for Emergency Response Africa. And it's, in your own words, why is emergency response such a critical pillar for health system transformation in Africa? A lot of people would say it's, infectious disease. A lot of people say it's non-communicable disease. And I think that third big area of emergencies and trauma has been sort of neglected in the conversation. So would you mind sort of articulating in your own words from a ERA perspective why emergency response is such a critical pillar for healthcare transformation in Africa?
Yeah, absolutely. Thanks for that question. I mean, the reality is, I'm sure if I take a quick poll of at least the Nigerians in the room, but I suspect, anybody who's in any developing context, and I ask a question around, have you ever been in an emergency or observed one, or maybe somebody who's in one or who's been in one, almost universally hands would go up. And that's because, it's the reality. Emergencies are things that happen anywhere and everywhere to everyone. At the same time, at least in Nigeria, the help that's required in the time frame that it's required often does not come. And the problem with that is that, when there's an emergency, what people need to be able to do is connect with the health system. So what you find is that emergencies, or let me say emergency systems, are oftentimes actually the first point of interaction that people or communities have with formal healthcare. Now, especially when you get into, more of the low resource areas, the sort of rural or peri-urban areas, that becomes even more important. The other thing is that, emergency care touches every part of the healthcare system. Whether we're talking about, primary, secondary, or tertiary, we're talking about the referrals between those levels, supply chains, data, all of that still plays into emergency care in some way. So the fact that that system does not exist in the way that it needs to is a huge challenge for the health system as a whole and has huge implications on health outcomes. One of my favorite, but perhaps the most shocking statistic, kind of in this space, is the fact that 54% of all the deaths that happen in lower middle income countries like Nigeria could actually be prevented if we just had access to timely emergency response. That is a huge number. And if you think about that in the context of Nigeria, that's about 1.23 million people every single year. So the need is there. It's really, really clear. But I think there's also some good news in all of this, right? Which is when you have something that is such an important and foundational piece of the healthcare system, it means that tackling it is a really great way to build resilience across the system and trust in the system as a whole, and ultimately just address that as a layer on which innovation can then be built. And I think for us at Emergency Response Africa, that's how we approach this problem. It's really about not just creating, as Dr. Amit said, kind of a single point solution, but thinking about it from the perspective of how it integrates with all the other parts of the healthcare system and building in such a way that other innovation can layer on top of it. So when we created our technology platform, we weren't just thinking, oh, we want people to be able to call for help. That's a phone number. You don't really need to do very much there. But we wanted a situation where the data that's being collected at the dispatch level can inform the hospital ahead so that they are prepared to receive the patient, can inform the government so that when they're thinking about policy or thinking about programs, they can take into consideration what emergencies are actually affecting the people. I think, if we can be successful in this endeavor, and, I believe we will be, we will make a foundation that a lot of other innovation within the healthcare system can be built on. And that's really the goal.
Okay, for Seth, whenever, healthcare or sorts of ecosystem thought leaders talk about artificial intelligence, there's a common response that Africa has no business with AI. Can you explain how you're using AI in your product? And whether you think Africa has any business with AI or whether we should just focus on the basics for now?
Thank you for the question. I think mostly everybody on this forum probably has used ChatGPT or some form of AI to some degree. AI is pretty much here to stay, and we just have to adapt to it. I think one of the ways that we need to look at AI is not that AI is going to take over, our jobs or, the things that doctors do, but rather to to help us in form of like a mega secretary, like a very efficient secretary. And AI is not only for clinical purposes. We have non-clinical uses of AI. For instance, one of the things that we are building right now is business insights, where we want hospitals to know that, okay, in a given month or in a given period, how many patients are taking X-rays or CT scans or MRI, and these will provide data-driven decisions for hospitals to invest in what type of machines they need to get. For instance, if there's more demand for X-ray, then it makes sense to buy another X-ray machine instead of asking each other, hey, do we need to get another X-ray? It looks like a lot of people. So that's the non-clinical use. For the clinical use, AI helps serve as a second eye for radiologists, right? Radiologists are overwhelmed. I mean, one radiologist is, if you look at the metrics, there's one radiologist to every 700,000 to 800,000 patients, right? So sometimes they can get tired. So if AI is able to tell you that, hey, look at these areas, pay attention to this part of the body, it will assist them in reporting accurately and also reduce the reporting time. So we are really excited about incorporating these AI, and it's something that is growing over time and improving over time. And our main goal is really to empower the service provider. As Dr. Ahmed mentioned, if you don't have the proper service providers in place, then it doesn't matter how much investment you have, right? It's not going to work. So you need to empower the doctors. You need to empower the people who are providing the service. Even right now, I believe in Ghana and some places, there are strikes going on with nurses and other health practitioners. We don't want that. With Instant Rad, we want to empower radiologists, not only with artificial intelligence, but also economically, because now they have access to multiple hospitals as before they didn't have access to. So now they are able to make more money. They're able to get more excited and more motivated to do the job, and the overall healthcare delivery process become improved.
And I'll just share a small personal experience that happened to me earlier this week. Like I said, I'm a physician by early training, but I've done a master's and just even finishing my PhD in finance. So I'm far away from the ground. But I needed like an MRI earlier this week. So I had the MRI and I looked at the image and I saw something. But when the report came through, it was missed. And like even me with my tired medical eyes, because obviously it was my MRI, if I was looking at 100 MRIs per day, I probably would have missed it too. But I was only looking at my own, and I also knew the symptoms that I'd been having. So I spotted it and took a picture with my phone, and I had to send it back. And I was like, look, you need to look at images. You need to look at this image again. But obviously, these are the problems I think that AI helps us as an assistant. And I think that Dr. Ahmed said this, and I think this is one of the most powerful things he said. He said that AI should help facilitate the work of human beings, not replace them. So it should act, like he said, as a superpowered secretary to say, oh, this is something, have a look over here. What do you think of this? Not replacing, but assisting. So yeah, it totally resonates with me. And definitely, I think that, the biggest exit in healthcare ever in Africa was an AI company. So we have a lot of business in AI, if that's the thing that brought nearly $1 billion back into our health tech ecosystem. And when $1 billion comes into our ecosystem, it goes into the hands of founders that invest in other health tech founders. It goes into the hands of employees that then become super angels to other small startups in the ecosystem. So an exit for us is a seed which germinates into another sort of haystack mafia or a flutterwave mafia or a money point mafia of founders and investors and angels. So I think it's super important for us to understand the trends in the world and sort of latch onto them. Last question from me is for LifeBank. And I wanted to understand what sort of the need is or how urgent the need is for medical supplies and this sort of delivery infrastructure across Africa, because you're now operating in 3 markets, I believe. So really how these digitally integrated supply chains and non-traditional healthcare infrastructure are reshaping access to care in Africa. And also what this means for scaling towards unicorn potential. And I'm going to ask the same question
that
to the other two panelists before we close.
that's a loaded one. But I'll start by saying that the way that we have recognized and imagined consumables and commodity movement within the health sector is such that you have to put the hospital at the center and think about the caregiver's mindset. Now, if you have to worry about where to get your commodity and also worry about its safety and then worry about getting it to your facility, you have deployed considerable mental energy in operations as against actually focusing on the patient's care. Now that is on the side of the caregiver. Now you now consider the patient who walks into a facility with the expectation that they will get all they need so that they can walk away feeling better or getting the confidence and assurance that they will feel better. And then if you take these perspective from the caregiver and the perspective of the patient, it becomes really clear that you walk into a hospital with doubt as a patient, and you provide care with doubt as the caregiver. And there's a way that technology can take these worries away. Now, on our part as LifeBank, we have now created technology that helps, first of all, caregivers to not worry about where do I get my products, because we've done the work on the due diligence to say these are the people that we have vetted and we trust them. Number two, because financing is a critical component in providing care, you want to be sure that you're getting the best product at the most competitive price, so that when these vendors are competing to fulfill your order, they create an opportunity to bring the price to the point that is most competitive. Now, as a caregiver, you are confident that when you go on the Nerve app and request for a consumable A, you know that you're getting the best in terms of quality and you're getting the best in terms of price. And that doubt factor, and I'm sure my brother at Eastern Ride understands what I'm saying, that when you're administering care, you have absolute confidence that the tools and the consumables that you're using to administer that is absolutely spot on. And when you create that intervention in 1, 10, 100, 1,000, 3,000 hospitals, we are almost in a gleeful state when we begin to document what we consider impact. And when you put that side by side with financial returns, we are incredibly confident that the conversation that Dr. Ola Brown is having around the potential for a unicorn in the coming years, that this approach puts us in the center of that conversation. Similarly, because government collaboration has been identified as critical to making this happen, we have built experience deploying technology that help governments, have visibility on stock, communicate with facilities that are far away, and create independent third-party logistics capabilities that deliver essential commodity to the last mile. And this has been demonstrated in countries. We have done with them in partnerships with international organizations, foundations, etc. And we believe that with the scope of technology and innovation that we have at our disposal, we are not only saving or serving patients, we are serving caregivers, we are serving care centers, and we are strengthening the system. Thank you.
Thanks. That was a very inspiring talk. Folake, I'd like to pose the same question to you as we begin to close, and then we're going to take a few questions. So people in the audience, if you can just write your questions in the chat, then I'll be able to read them out and pose them to the founders. I can see a lot of people that are still sort of working on their businesses and working on concepts. There's a few investors in the room. and a few doctors I can see as well, a few lab medical scientists. So please pose your questions, any questions that you want the founders to answer, and I will ask on your behalf. But yeah, to Folake, the news has all been about fintech unicorns. 95% of all unicorns that have been formed in Africa are fintech. And that's why most of the money that goes into or comes into Africa is geared towards fintech. Most of the international investors that want to invest in fintech. Even whilst raising a fund for Africa, people still say, you are going to invest in fintech, right? How can we get at the fintechs? Because they've been so successful. What do you think the route is for health tech unicorns in Africa? And do you agree with Dr. Amit that it's going to be in the next few years, not decades?
Yeah, thanks for that question. I mean, I think whenever I think of kind of fintech as a whole, I think it's important to recognize some of the things that were critical success factors for that to exist. We in health tech, we talk about infrastructure and how little infrastructure there is. And I think with fintech, of course, they did a lot of building, but they had, some foundation to build upon. And on that foundation, they were able to accelerate. And I guess the point I'm making is the comparison is not apples to apples. It is one that we can learn from and leverage to create these health tech unicorns. I want to maybe just focus on a couple of examples, and I think you touched on this already. 2 examples of companies that I think of in the emergency response space that point to what's possible in terms of significant growth and exits, and I think kind of speak to what we can expect to see in the African context. Rapid Deploy, I think, is the one that you mentioned, and this is a South African company, that created a fantastic technology solution for aggregating emergency response. But one of the big shifts for them was taking that solution into the US market and starting to sell to government PSAPs, as they call them, the public safety access points. And that, really, really scaled to the point where they were acquired by Motorola. Zikitsa is another example, but in India. And this is an organization that had a hybrid sort of corporate and government model and built that, scaled that out until they were acquired by a global company called Emergency. What are some of the things that I think we can learn from these 2 examples and have implications for Africa? One, these companies build solutions that had relevance beyond their immediate local context. And I think that's critical for us getting to, the health tech unicorn. It can't just be about, the one state or the one city or even the one country. And I love, the 2 panelists and, what they've shared about their companies. They are already operating in multiple markets, and it's very easy to see how their solutions can easily transcend the African border and get into other areas. And I think that's really critical for us getting to that unicorn status. The other things that I see, broad business models. So not restricting yourself to only the wealthy or only the poor or only corporates or only government. Being able to work across all of those that's what expands the market. That is the market. The other thing is just pioneering. I mean, I heard this a lot from the other 2 panelists as well, just not being afraid to be the first to do something or to be the one to say, well, this thing exists, but it can be done differently. And here's how my data is going to help shape policy and practices. And I hear that from them. And I think that's a great example that we see with the 2 companies that I've mentioned. But I think, maybe to kind of round it out, money is critical at the end of the day. The 2 examples that I highlighted, these were companies that received a reasonably significant amount of funding, especially in the context of health tech, which is, so much less funded than fintech, for example. But they did have a reasonable amount of funding that allowed them, and maybe not just a reasonable amount, but the types of funding that allowed them to do the things that they needed to do. So the patient capital enabled them to experiment and test different models and try out new markets. But they also had the traditional VC capital that allowed them to accelerate what they were working on. And I think that's how we need to be thinking about the African health tech market. And if we're trying to get to unicorn status, it has to be that combination of capital and those factors that the founders are working on.
Fantastic. And Seth, same question to you around what do you think the routes to having a health tech unicorn in Africa is? And do you think Dr. Amit was right that it's going to be years rather than decades?
Absolutely. I think that, we can all agree that Africa it's not the same like the rest of the world. Things happen so quickly. We literally became the largest mobile phone owners in the world just in less than a decade. And there's a lot of innovation now that we have these low orbit satellite internet. Now, Starlink, technology like Starlink, and I think Amazon is coming up with some other models, may take over. So internet access may be very ubiquitous than we may think. But for us, I think that if we are able to create, for instance, right, if platforms, health tech platforms are able to create models that empower the service provider, I think that will help us to get to unicorn status quite faster. Because if you look at some of the, if you run a SWOT analysis on African healthcare issues, among the list of issues that we have, one of the pressing ones are doctors or physicians being discouraged, brain drain issues, strikes, as I mentioned earlier. So if we are able to empower them with technology, right? We empower them with tools that make their work easier, less inconvenient. I believe that they will be able to, go far and beyond, and it will be easily embraced. And, I think that's how some of these startups like us will be able to expand easily, because that's what we are doing in other countries. When we go to different countries, we don't necessarily go to the hospitals first. We go to the doctors, the people who are providing the service, and then we ask them, what issues are you facing? And then we present our technology to them, and they love it because it makes their work easier, more convenient, and they take it from there and then they run with it. So I think that emphasizing on the service provider, making their work easier, will create a natural ripple effect throughout the healthcare delivery process, and all other systems will come into play. Secondly is with health tech, I believe that the natural investment in healthcare will occur at the hospital level. For instance, because of Instant RAD, now hospitals are more comfortable to invest in medical imaging equipment, right? Previously, hospitals didn't want to buy a CT scan, very expensive, or MRI, because they didn't have a radiologist who was going to be on site to report those cases. Now, because of Instant RAD, health tech companies like Instant RAD, we've given them a reason to purchase and invest in medical imaging equipment. Same thing with there are hospitals today who are now moving from 7 a.m. till I think 6 p.m. Schedule to now 24 hours because of health tech. No one is going to sit at a facility all day long. So with Instant RAD now, we have facilities who are now running a 24-hour economy. Now, if you can come in at 2 a.m., we have doctors who are online who can report cases. And we are basically, getting closer to, the developed world, standards. And that's what I think we will help, most of these startups in the health tech reach unicorn status, empowering the service provider. So.
Fantastic. And I love what you said about speed, because if you think back to 2008 in China, there were no unicorns in the whole of China. 10 years later, by 2018, there were nearly 100. So sometimes in emerging markets, it looks like nothing is happening, then everything happens all at once. So we're going to quickly move on to a few questions. Let me check what questions have come in. What are the biggest drivers for digital health solutions? And this is from Yusuf, in terms of looking at it from a health system strengthening perspective and also direct to customer perspective. So does anybody want to take that?
That's an interesting question. When you say driver, you mean what motivates a user to need or desire the intervention of technology to solve a problem? Would that be another way to characterize or coin that question then?
I think that's probably what he was getting at, yes.
Excellent. So everybody wants to be able to solve a problem, especially in the context of healthcare. And what Instant Rad is doing is attempting to solve a problem. Now, when you're looking to offer quality, valuable service, and you're trying to guarantee it some sort of outcome, you are looking for leverage. And leverage gives you that ability to overcome obvious challenges on your way to delivering value. So some of the problems that we had identified, for instance, quality consumables. How do I know that this blood is safe?
Mm-hmm.
And in that thought alone begins to make you automatically think, who can help me guarantee that this blood is safe? And when someone positions themselves as an organization that brings technology to guarantee blood safety, there's then a connection between that initial thought and the need to a technology intervention. And you can take this story I've just told in a few seconds and put it across the whole healthcare value chain. And you will begin to see that doctors who are spent in using traditional means to solve problems will only be incrementally or exponentially more productive when technology is infused to deliver value. So I imagine that care centers and care providers are looking for technology as leverage because they desire to see even greater impact in patients. Thank you.
Thank you. This one is directly to Folake, and it's from Damien Madugu. And he's asking, dear Dr. Folake, how did you navigate the challenge of Africa still being immature tech-wise? If I got you correctly, your startup focuses on providing accessible emergency services. However, Africa and Nigeria are still developing. There are so many people that are semi-literate in terms of using their mobile phones. What's your go-to-market strategy when you get started?
Absolutely. Yeah, that's a great question. And I mean, the answer is also really simple. We don't try to force people to use technology in ways that are unnatural. And what I mean by that is our research showed us very clearly that when somebody has an emergency, the action that they take is to make a phone call. And so we do most people reach us by telephone. They can simply pick up the phone and call a toll-free number and communicate with a medical dispatcher. Now, it would be nice if people could, push a button on an app, because then, for example, we would automatically get their location. When you have a phone call, you then have to have a conversation about where are you and, and that adds to the response time. But the reality is, like you've said, a lot of people, in terms of their behavior, will still make a phone call over pushing a button in that context. And because our goal is to serve the patient as best as possible, or the customer as best as possible, we align with that. Now, what it means is that the other parts of our technology are what then help the response to be more efficient. So the responders are receiving the details of the case from the dispatcher, and they can then use a smartphone and navigate to the scene of the emergency. They can put information into the app when they're in the field, and the hospitals can also receive information. Again, a lot of times by phone, because we know that adoption can be a challenge even at the healthcare facility level. So we really try to adapt the technology to the needs of the user. And I know there's kind of a related question on like the simplicity of the technology. So I'll just like upfront answer it. There are many places in Nigeria that the network is just bad. Internet access is poor. And to rely on internet access is to decide not to do your job. And so for those environments, we have created solutions that use, SMS, USSD, that don't require, an internet connection or a smartphone, but still allow the dispatching to happen, still allow the data to be collected. And that's how we're able to work in the more rural, remote parts of Nigeria.
Thank you. And I think that that's all we have time for right now. So I would like to hand over to our investment principal, Samson, for his closing comments.
Awesome. Thank you so much, Dr. Brown. Wow. What a day. It's been an amazing session. First, like to appreciate everyone, all attendees, for joining the session. Thank our wonderful portfolio companies represented by Seth, Aniekon and Folake, and also appreciate Dr. Amit for that very instructive keynote that he shared. And a couple of things stood out for me, right? One thing that I picked out was the fact that, and just reiterated the narrative of why healthcare is extremely important. The fact that healthcare is a fundamental right and not a privilege. So I always tell people something, right? If you invest in healthcare, you're doing two things at the same time. One, every single dollar you invest has the ability to save a life. And because of the type of importance healthcare is, being a non-cyclical sector is also capable of generating returns, right? So, the narrative is clear. Hearing that one company has been responsible for $3 billion worth of investments in Asia alone, that's almost 10% of Nigeria's external reserves. It's very inspirational for us as capital providers, right? It means we have a long way to go across the ecosystem, both from the capital provider side of things, from the startups, the ones building the dream and the vision for the continent. It means we have a long way to go. And some of the key points he also mentioned around the fact that to really, really drive the continent closer and the sector closer to unicorn status, considering the large infrastructure gaps, we have to think platform building, we have to think ecosystem building, right? We have to think about measurable impacts. We have to think about leveraging the fact that one thing we've been able to get right as a continent is move very fast from a digital penetration and smartphone usage perspective. It means that we have to leverage that advantage. And the fact that we have to think regional and act global, right? And the big call to action that I picked out, the opportunity is now. For us to achieve that goal of achieving our first health tech unicorn on the continent in the next 2 to 3 years, we have to start building, we have to start moving fast, and we have to think platform building, and we have to do the things right to get the continent to where it needs to be. Thank you everyone for joining the session, and hoping we get to chat some other time. Thank you.